We're going to call the meeting to order. We're going to begin with a hearing on Senate Bill 434, and we'll start with an overview from Eileen.
Good morning, Madam Chair and members of the committee. I hope you all ate your Wheaties this morning and are ready for some hairy issues that we're going to deal with. Thank you. That was Jenna's joke. You'll note that she gave it to me to deliver. She's such a friend. Senate Bill 434 is exempting the practice of hair removal by sugaring from the definition of cosmetology. Section 1 of the bill amends KSA 65-1901, which is the definition section, for Article 19, which is licensure of entities by the State Board of Cosmetology. Under current law, there are a number of practices that are excluded from the definition of cosmetology. These practices are listed under subsection C2 in subparagraphs A and B, and those are for hair braiding and threading. The bill would amend subparagraph B to add temporary hair removal by sugaring to the exclusion for threading, so long as the requirements of KSA 65-1928 are met. And then we add the definition of sugaring in the same section at subsection L. Section 2 of the bill would amend KSA 65-1928 and would require the Secretary of Health and Environment to add information about infection control for sugaring to the already existing brochure on the same topic that covers hair braiding and threading. If enacted, this bill would become effective on July 1st of this year. And with that, I can stand for questions.
Committee, do we have any questions for Eileen this morning? Seeing none, thank you, Eileen. We'll begin with our proponent, Sam McRoberts.
Good morning. I am Sam McRoberts. I'm litigation director at Kansas Justice Institute. And indeed, I hope everyone did have their Wheaties. I brought some cosmetology textbooks for everyone's review. I represent Bryn Green, and Bryn wants to start a sugaring business, but she can't do it given the extraordinarily high number of hours that are put forth to get a license in Kansas. So sugaring is completely safe. It's an all-natural product that's made with sugar, lemon juice, and water. It forms a paste. This is unlike waxing. So waxing can be applied, or it is applied at a very high temperature, not with sugaring. Sugaring is applied at body temperature, so there's no risk of burning. It's much safer than waxing. You can use it on skin that has psoriasis or eczema or spider veins, and you can use it on the same location multiple times. If you want to remove the paste, you just use a warm washcloth to remove it. There's no need to require 1,500 hours of irrelevant schooling to learn how to perform sugaring. Sugaring takes maybe an hour to learn, and how to, if you don't know this, wash your hands before you do it. It's estimated that less than 1% of the cosmetology curriculum is devoted to sugaring, if it's even being taught at all. And the practical examination doesn't test sugaring either. So in order to become a sugarer, you're gonna have to spend tens of thousands of dollars at an expensive cosmetology school to learn completely irrelevant things and get tested on irrelevant subjects. So for all of those reasons, because this is already a safe type of temporary hair removal technique, the 1,500 hours or even 1,000 hours is too much, and we would ask for the exemption. And I'm happy to stand for questions.
Committee, thank you, Sam. Do we have questions for Sam? All right, great job. Seeing none. And now we'll move to Wendy. Oh, Wendy is written only. Also, committee, I would draw your attention to what appeared to be opponent testimony is actually proponent a testimony from Jonathan Luth at Americans for Prosperity. Seeing no questions, we will close the hearing on Senate Bill 434 and move to a hearing on Senate Bill 461. And Eileen, would you give us an overview?
Again, thank you, Madam Chair and members of the committee. Senate Bill 461 would enact a whole new provision of law named the Laser Hair Removal Act. This is actually contained in all one section, so you'll see definitions contained in subsection B. Definitions are now being created for laser hair removal, laser hair removal facility, and laser practitioner. Subsection C of the bill restricts the performance of laser hair removal to healthcare professionals as defined in KSA 65-1113 or pursuant to light-based medical treatment regulations. This subsection prohibits a person from presenting themselves as being authorized to perform laser hair removal unless authorized to do so. Subsection D prohibits laser practitioners from using lasers other than those approved by the FDA for non-invasive procedures. Subsection E of the bill requires a non-physician laser practitioner to complete a laser practitioner training and education program, and that subsection also defines the requirements for such a program. Subsection F is where kind of the requirements for administration go. Subsection F requires that a physician serve as the medical director of a laser hair removal facility, and that physician would be required to establish written practice protocols for laser hair removal and complication management. A physician shall not be required to be physically present or immediately available to supervise laser hair removal procedures, but shall be required to be available for communication either live in person or via real-time two-way communication. A physician shall also determine the number of physician assistants who can practice under that physician's supervision at different laser hair removal facilities, but the physician will be required to use professional judgment regarding that physician's ability to adequately supervise each PA, physician assistant, based on factors adopted in rules and regs developed by the Board of Healing Arts. This subsection requires a physician to review at least 10% of patient records and requires complication management protocols to utilize a physician, a PA, or an advanced practice registered nurse who may be available by two-way real-time interactive communication. Lastly, the act should not be construed to prohibit anyone in the healing arts or practice of nursing from engaging in the practice for which they're licensed or certified. And again, if enacted, this bill would become effective on July 1st of this year. And I can stand for questions.
Committee, any questions for Eileen this morning? Seeing none, thank you, Eileen. We are going to begin with our first proponent, and that would be Jared Widseth and Nathan. Okay, so we'll start with you, right? And you're Jared?
Yes.
Would you introduce yourself totally?
Yes. Good morning, Madam Chair. Good morning, members of the committee. My name is Jared Widseth. I'm General Counsel and Corporate Secretary to Milan Laser Hair Removal. Today I'm joined by my colleague, Dr. Nate Hacker. With permission of the chair, I plan to address our first few comments, and Dr. Hacker will address comments in the middle, then I'll briefly conclude. Laser hair removal is a popular alternative to shaving, waxing, and sugaring. Unlike shaving, waxing, and sugaring, it provides permanent results over 7 to 10 treatments. Milan Laser Hair Removal is founded and headquartered in Omaha, Nebraska, founded by 2 board-certified physicians in 2012. We are the largest laser hair removal company in the country with over 300 clinics in 34 states, including 6 clinics in Kansas. Current Kansas law, which is older than Milan Laser Hair Removal, the regulatory environment was last touched 18 years ago, requires that doctors be on site or immediately available, which is the crux of our issue today. And I'm going to invite Dr. Nate Hacker up to talk about the safety and efficacy of laser hair removal.
Good morning. I'm Nate Hacker, Chief Medical Officer for Milan Laser. Laser hair removal is a popular alternative to waxing and shaving because it's a permanent solution. Most patients are 95 to 100% hair-free in their treated areas after 7 to 10 treatments. There are many ways to temporarily remove hair, but for permanent results, laser hair removal is the safest treatment. It's performed with a non-ablative, non-invasive laser. that directly targets the hair follicle. In contrast to risks associated with skin procedures performed with ablative lasers, the risk of complications or adverse events from laser hair removal to perform the procedure of laser hair removal is very low. If complications do occur, they are temporary skin pigment changes or a mild burn similar to a sunburn that can be effectively treated with over-the-counter products such as aloe and moisturizer. So because laser hair removal is extremely safe, at least 30 other states allow licensed nurses to perform the treatments without direct or on-site physician supervision.
So as we discussed, laser hair removal is popular, safe, and effective. We ask that Kansas join the 30 other states that allow nurses to perform laser hair removal without on-site direct supervision from a physician, so that we can bring this popular service to more Kansans, delivered by folks that will have high-paying jobs. And Dr. Hacker and I are happy to stand for questions.
Questions, committee? All right, seeing none, thank you very much.
Madam Chair.
Committee, I would draw your attention to two written-only proponents, which is Jonathan Luth with Americans for Prosperity and William Wilk with the Kansas Chamber. Opponents will begin with Dr. Aaron Fast, and he's on WebEx with us. Can you hear us, Dr. Fast?
I can. Good morning. Thank you, Senator Gossage, for the opportunity to testify before this committee. My name is Aaron Fast. I'm a family physician, and I own my own practice in Heston, Kansas. The Kansas Medical Society opposes Senate Bill 461 due to limitations on physician delegation and telemedicine defects. Before I start, I'd like to give you a couple of disclaimers. First of all, I'm currently in Washington, D.C. at a national advocacy conference, and any technical difficulties are on me today. Secondly, I currently don't offer laser hair removal in my practice, but I could. And thirdly, as president of the Kansas Medical Society, we previously met with Milan Laser Hair Removal and discussed our specific concerns about the language in this bill. My final disclaimer is that as a patient, God has blessed me with a lot of hair, and I have never had laser hair removal personally. On to the issues. First, this bill severely restricts the physician ability to delegate. Current statute does not restrict physicians to delegate under your supervision. So what does this mean? For example, in my practice, if I have a cast that needs to be removed, I can delegate that to my nurse, even though she doesn't have the authority to do so. Because I'm in the office, she is supervised by me. So I am responsible for any delegated acts as if I personally perform them, and it's incumbent upon me to hold that standard of care, whether I perform my act myself or I delegate that. However, in this bill, a physician couldn't delegate laser hair removal to an esthetician, even if they were physically present and in the same room to remove that hair. Secondly, if this bill were to be passed, it would create a two-tiered system for patient care. There would be one standard for in-person care and a different standard for telemedicine or telehealth. Kansas Medical Society believes that the same standard of care should apply for in-person visits as for telemedicine visits, and the protection that is offered in in-person care should be also present in telemedicine. Maintaining the current standard of care is imperative for our patients' protection. This bill additionally offers several questions about telemedicine that have yet to be answered, and I'm confident that the Board of Healing Arts could speak to these telemedicine issues. Finally, in addition, Kansas Medical Society has 2,500 physician members across Kansas. None of our members have come forward with concerns about access to laser hair removal. We have spoken with multiple dermatologists about this issue, and they don't have any concerns about the current regulation of lasers. Furthermore, no state currently restricts the physician delegatory authority, and this authority is critical to team-based care. This statutory approach would have different standards for both in-person and telemedicine care. This approach has not been tested or implemented in any state across the nation. It is unnecessary to have this bill to access laser hair removal, and it compromises patient care. For these reasons, we urge you not to advance Senate Bill 460, and I'd be happy to respond to any questions at the appropriate time.
Committee, our other opponent testimony is written only, so do we have any questions for Dr. Fast? We have a question from Senator Thompson.
Thank you, Madam Chair. Doctor, are there any stats about injuries or damage caused by these laser hair procedure at all, about the safety and efficacy and things of that nature that would require the more rigorous physician oversight?
Thank you for that question. The dermatologists we spoke to did not give me an incident rate of complications, but they do respond to any complications if there are complications that arise. And that is why the current, I believe it's a 5-minute window of when they need to come over and assess the patient for any problems.
Thank you, Madam Chair.
Actually, my question would be for the proponents, if you would like to come up and address what was mentioned here, that you, Dr. Fast had said he had met with you, and what were your thoughts about this? What was the conclusion from that meeting?
Thank you, Madam Chair, for that question. We did meet with the Kansas Medical Society. Our goal is not to have a conflict. We were trying to get stakeholders aligned ahead of this conversation, and we simply couldn't. We have I guess, a disagreement on how to go forward. We had a productive meeting. I think everything that Dr. Fast shared, he shared with us on the call. There's really no difference between what he spoke to today, what I spoke to today, and the call that we previously had, if that's helpful.
So in the bill, so the concern seems to be that it restricts permission to delegate. Do you feel that it restricts permission to delegate?
We don't feel today that our bill restricts permission to delegate. In fact, we find this as an expansion to physician delegation because it enables the physician to delegate to these nurses without being on site. So we don't view it as a delegation restriction, no.
And and also the one standard for telehealth and the other standard for in-person. I'm not exactly sure how laser hair removal could be done remotely unless it would be the physician guiding a nurse or an anesthetist.
Madam Chair, I'm also a bit confounded by that difference in standard. One other point that came up that Dr. Fast addressed is the limitation for a doctor to delegate to other persons. Our understanding of our bill is we're not restricting doctor delegation to other persons. That's not the goal of our bill, and I confirm that in our bill draft. Yeah.
Okay. Any other questions from the committee?
Thanks. Yeah. So specifically, we're looking at line 28 of the bill. So C1 starts with, except as provided in the section on after Jan 1, no person shall perform or attempt to perform laser hair removal unless such person is a healthcare professional. By this section are pursuant to light-based medical treatment regulations adopted by the Board of Healing Arts. We view that section as permitting physicians still to delegate if they're on site to other persons. What we're asking for is for nurses only, LPNs and RNs, to be able to perform laser hair removal without direct on-site supervision.
So what you're saying is they don't have that capability now?
Nurses today do not have that ability, correct?
Even if the doctor is present?
If the doctor is present, they do have that
Yes.
ability, but that is a requirement that we're seeking to remove.
Thank you. Senator Petty.
Thank you. I know under the opponent testimony, it was brought forward about the supervision and the it appears to be unlimited number of assistants that would be supervised, and as well as the number of training hours. Could you speak to that?
Yes. So we are offering this testimony as the nation's leader in laser hair removal, and this is the operating model that we found to be maximally safe and effective. And so we believe so strongly in this model that across the river in states like Missouri that have a much weaker regulatory environment, we still choose to deploy this model of having a medical doctor oversee a team of nurses, and we find that that is perfectly appropriate. We spoke, Dr. Fass spoke briefly about the 5-minute availability for complication response time. And in our experience, if you get burned by our laser, which happens less than 1% of the time, in fact, a fraction of 1% of the time, if complication is responded to in 5 minutes or 5 hours or 5 days, there's not a meaningfully different prognosis. That complication, I would invite Dr. Hacker to opine a little bit more on the safety and efficacy of our complication management.
Yes, specifically about complication management, Jared already spoke to the fact that complication rates are extremely low. In our practice, complication rates are always less than 1% of all treatments. And as he mentioned, a treatment burn, which is almost always a first-degree burn similar to a sunburn, generally is a fraction of 1%. And as he mentioned, the response time for such a minor complication is really not critical. However, from a customer service standpoint, we take it very seriously and respond via telecommunication as quickly as we can. But as he mentioned, whether it's a minute, 5 minutes, or 5 hours, minor pigment changes or a minor burn is treated the same with over-the-counter topical products.
And then I want to address, you talked about training, so I want to just briefly address that. We've offered the training model that we find to be appropriate. We think this is the right level of training for these folks.
I'm not sure you actually expounded on currently a physician has supervision over 2, and this seems to have unlimited supervision.
Oh, sure. Yes, what we're offering today is unlimited supervision of delegates. That's true. This is based on our experience in the industry and what we think is the appropriate model.
Yes, Senator Blasey.
Thank you, Madam Chair. Just clarifying, you mentioned something about, is this bill specifically outlining that only APRNs or PAs, LPNs can perform this? Because currently my understanding is physicians can delegate to anybody, but you're saying this bill is only going to specifically outline specific careers.
Physicians will still be able to delegate to anybody, Senator, when they're on site. However, in this bill, physicians will not have to be on site or immediately available if they are delegating to an LPN or RN, or APRN or PA.
Is this unique to Kansas? Do other states do that?
Kansas is in the minority of states. I
mean, in terms of this bill, is Kansas the only state where you're specifically stating which professions can do it instead of allowing physicians to delegate to anybody? Right now, physicians can delegate to RNs, but this bill doesn't allow that. This bill just says APRNs or PAs or so on without the supervision of a physician.
The purpose of our bill is for physicians to be able to delegate to those licensed healthcare professionals and not have to be on site. And a physician can still delegate to other persons if they are on site. That's what our bill is offering today. And then as far as the broader regulatory environment, I can't speak to all 50 states, the exact where it lies in statute and where it lies in code, but generally speaking, there are 30 states that allow for nurses to perform this procedure without direct on-site supervision.
And just one more clarification, this bill's about laser hair removal. Is this laser going to be, is it very specific, maybe a question for the revisor, is it very specific only for the removal of hair, or is it can be used for other things? I mean, we use lasers for a lot of things in healthcare, just curious.
I'll yield to the revisor, otherwise Dr. Hacker can speak about our laser.
Thank you, Madam
Go ahead,
Chair.
Jenna.
Jenna Moyer, Revisor Statutes Office. The definition of laser hair removal specifies the types of lasers that can be used, the class 3 or class 4 laser product, as they're defined in federal regulations, the use of which has been approved by the FDA in performing a non-ablative hair removal procedure that does not remove the epidermis. This is the same definition of laser that is in the current regulatory definition for, KAR 100-27-1, which is the current Board of Healing Arts regulations for supervision of light-based medical treatments or lasers.
Committee, do we have other questions for the proponents or the opponent? Dr. Stefan.
Thank you. I apologize for coming in late in case I'm rehashing old territory, but do we have any data, closed claim data from medical malpractice or the Healthcare Stabilization Fund regarding laser hair removal and the risk thereof?
I can't speak to the data that the Kansas Healthcare Stabilization Fund has. I can share our data, which is complications occur less than 1% of the time. Significant complications, a fraction of 1% of the time, which are, as Dr. Hacker alluded to, burns akin to a sunburn, hypopigmentation. The complications are minor and rare.
Does anybody know of a medical malpractice suit that's been brought against laser hair removal and won in the state of Kansas?
I can only speak to my experience, and I'm not aware of any claims or litigation in the state of Kansas regarding laser hair removal against Milan.
Any other questions, committee? Yes, Senator Baumgartner.
Thank you, Madam Chair. Talk to us a little bit about the subsection that requires a physician to review at least 10% of patient records. Only 10%.
Certainly. Thank you, Senator Baumgartner, for the question. We offered that piece of the bill because we wanted to include physician oversight in to specify the appropriate level of chart review, and that was simply that we think that's an appropriate level of review of charts to audit 10% charts.
So this is, if I might, Madam Chair, this is just reviewing them after the procedure has been done?
Yes.
Not a patient chart prior to?
Correct.
And when you say delegating to another a physician can delegate to any other individual, what you're really saying is the physician is not scheduled to be in the facility when patients are receiving treatment. The physician isn't scheduled, but other employees are scheduled.
That's correct, Senator.
So when does a physician ever look before treatment is done? Who is it that is actually looking at a patient record?
Dr. Hacker, do you want to address that?
That's a good question. The process that we follow, and that is fairly standard with laser hair removal, is the patient would complete a health history form, and then that would be reviewed by the licensed nurse or whatever the provider is in that particular state. All of our treatments are based upon protocol, medical protocol that's created and reviewed on a regular basis by a physician. So therefore, the procedure is still physician directed, but delegating down the treatment itself, the health history review, the assessment on site of the patient, following protocols that are created and reviewed by the physician. Very similar to other healthcare settings. In a hospital setting, for instance, a physician is not always on site for every treatment that's provided by a nurse. Nurses follow orders, protocols to dispense medication, to complete medical treatment when the physician is not on site in the hospital.
I guess, Madam Chair, we can talk about protocol, but a protocol can be established and not reviewed for another year or more. And to compare this to a hospital where there are always going to be physicians in a hospital. There's always going to be someone, it may not be the individual patient's physician, But if there's a code, someone is responding, and it is going to be a physician. So I guess from a protocol standpoint, how many weeks might pass before a physician actually visits that particular site? Because when you're talking about only reviewing 10% of records, that's after procedures have been done. If you see 100 patients in a week, 10%, you're talking, going to look at 10 files, but it doesn't, there's not a time frame for that. It could be just at the end of the year. Is that correct?
That is correct. Based upon what we know about other states, in the 30-plus states that we're in right now, there are no other states that require chart review at all. So that even adding a 10% requirement would be an additional requirement that's not common for laser hair removal across the nation.
So in your other states, what is the ratio of a physician to actual employees?
It depends on state law. Some have, may have some ratio requirements, but in the majority of states that we're in, there is no limit for physician oversight.
So what is, you keep referring to your protocols and your business, what's your broadest and most narrow ratio?
Our broadest ratio is unlimited providers per physician.
Right. Now, what is that, though, in actuality? One physician, how many employees? Is it 100 employees? Is it 150 employees?
We generally base it per clinic. We have one medical director per clinic, and the most that we have at this point is approximately, I don't have the specific number off the top of my head, but approximately 50 clinics per one physician.
50 clinics.
Clinics with an average of approximately 2.5 providers per clinic. So I would estimate a couple hundred providers per physician would be the broadest.
So when you say provider, it's not a physician, it's just employees that perform the laser removal.
Correct. Nurses or nurse practitioners.
So one physician, 50 centers, an average of 2.5 licensed or certified individuals.
All licensed. All of our providers are nurses or nurse practitioners.
But in this, you're saying they don't have to be.
No, we are recommending that they all be licensed nurses,
Okay.
LPNs or RNs.
I want to clarify, what we're offering is, we're not trying to upset the apple cart of Kansas state law. We're not trying to disrupt or prohibit doctors from delegating to technicians or unlicensed persons when they're on site. What we're seeking to do is to remove the requirement for doctors to be on site when it's performed by nurses.
Thank you, Madam Chair.
So my question is for Dr. Fast. And so the way I'm understanding it is when I read the opponent testimony, the major concern is delineating which providers a physician can delegate to, that you feel like it's narrowing that. Is that right, Dr. Fast? Are you still with us?
Yes, thank you, Senator Gossage, for the question. Based on how I read the language of the bill, it would not allow physicians to delegate to an unlicensed person like an esthetician if they were to do the laser hair removal. I don't see with this bill that it would allow physicians to supervise those other non-licensed people if they are in the same facility.
If they're in the same facility, it seems like you could. It seems to be the problem is the telemedicine.
Yes, I think you've described that accurately. We see two problems. We see the telemedicine as a separate problem, and we see the fact that physicians are restricted on who they can delegate in the current language as presented.
All right, thank you so much. Committee, do we have any other questions? Yes. Oh, okay. No, we do not. All right. Seeing none, committee, this closes the hearing on Senate Bill 461. And now we will turn to final action on Senate Bill 103. Give you a minute to pull that up. Committee, if you've all had a moment to pull up Senate Bill 103, do we have any questions before we, or any discussion before we work this bill or vote on this bill? Eileen, would you give us, or Jenna, a quick overview?
Thank you, Madam Chair. Senate Bill 103 updates some of the Dental Practice Act requirements. The first section talks about the contact information that a dentist would be required to provide to a patient who requested it. Section 2 strikes that 20% requirement. So current law prohibits a dentist from being associated with the clinic unless they're in that clinic personally at least 20% of the time. And then Section 3 adds to that list of actions that could subject a dentist to professional discipline if the dentist has directed or pressured another dentist or employee to perform dental care that fails to uphold the applicable standard of dental care.
So basically what we're talking about is eliminating the 20% requirement for putting your name on a dental facility, but you would have a licensed dentist. It must be in that facility. The owner does not have to be present, but there must be a licensed dentist in the facility.
Correct. To provide dental services requiring supervision of a dentist, you would have to have a dentist present, but the name on the door or the ownership group.
Could you remind us, this is, if I remember correctly from testimony, Kansas is the only state that has this requirement.
I don't specifically remember, but that sounds.
We're seeing head nods. Okay. Thank you. Committee, do we have other discussion before we have a motion vote on this bill? Seeing none, do I hear a motion? Senator Erickson.
Thank you, Madam Chair. I move that we pass Senate Bill 103 out of committee favorably.
Do I hear a second? Senator O'Shea and committee, all in favor say aye. Aye. Opposed? No. Okay, chair is undecided, so can I see a hand if you are for the bill? Raise your hand. Seeing 4. Opposed? And chair breaks the tie. I am for the bill. We will move that on to the Senate. Committee, we have completed our work for today. The committee is adjourned.